My name is Kathryn. I'm one of the paediatric cardiologists at Starship Children's Hospital. And between Sophia and I, we're here to try and encourage people to participate in the next big study that's being undertaken through the Fontan Registry, which is functional outcomes study. And hopefully there's been quite a few people that have been through in Melbourne, and I think one of those people is going to speak after us and hopefully say how great the experience was. But for the New Zealand Fontan participants, we're sort of getting started with recruitment, so we're really keen for people to get involved because it's quite a comprehensive study, as I'll show you. So I just wanted to start off by talking a little bit about what we do know about the Fontan circulation, because it has been around for quite a while, and what's sort of changed over time, apart from the modifications to the Fontan connection itself, is also the different anatomy that we're offering the Fontan to, which is exponentially grown. So it's kind of gone from originally offering it to tricuspid atresia to now so many different variations of ventricles where you're not going to achieve a two-ventricle system. And I don't know, there might be some people in the room who remember the original Dr. Dolittle series. There'll be some that only remember Eddie Murphy and his Dr. Dolittle movies that are more recent. But I kind of like to think of the Fontan circulation as a sort of push me, pull you circulation, and I'll try and explain why. So basically, you've only got one pump, and that pump is reserved for getting the blood to the body. So basically, that pump is pushing the blood both to the head and all around the body. You haven't got a pump to the pulmonary circulation, so you've got to have some mechanism of, once the pump has done its work to push the blood, you've somehow got to pull it also through the rest of the circulation. And so if people have alluded to, part of that is actually your breathing, so having really good lungs to try and help pull the blood back from the body to the Fontan circuit and through the lungs is really important. And then there's this combination of also the lungs, as you breathe out, pushing the blood back towards the heart, and also the heart itself, as it relaxes, has a pulling action, so it's kind of like a vacuum that's kind of sucking the blood back to the heart. So you're reliant on one pump for the body and no pump to the lungs. So to make it work, you need, on the push side, a really good pump that's going to squeeze to push the blood around the circulation. You need a pressure gradient. Obviously, to generate flow, you need to have a high pressure gradient to a low pressure gradient. And so you need to have low resistance to flow and also a low pressure at the end of the circulation to help keep the blood moving through the circulation. And you also need good lungs so that when you breathe out, the blood is pushed back to the heart. On the pull side, you need a good pump to relax. So it's not only the squeezing action, it's actually the relaxing action of the heart, and that helps pull the blood back to the heart. Again, you need that low resistance to flow in the pipes so that you've got a really smooth kind of no friction within the circulation so that the blood moves nice and smoothly. And you need sort of that low pressure at the end of the circulation so that the blood keeps moving through. And you also, again, need the good lungs so that when you breathe in, it helps to suck that blood up through the Fontan and into the lungs. So we know all of this, but there's a huge amount that we still don't know with the Fontan circulation. So we don't really understand what determines the heart pump push and pull function. So is it the different type of ventricle that you're working with? Is it the different pressures that you put on the circulation? Is it the different surgeries that you've had before you get to the Fontan that make an influence on the push and pull function of the heart? These are all things that we would like to know, and we're trying to find out. We also don't know all of the influences that have impact on the resistance to flow. What are the things that contribute to more turbulent flow, to sort of difficulties with increased pressure within the circulation, all of those kind of things. We don't know how much impact there is with the type of Fontan connection and how that alters the circulation flow. We've obviously made modifications along the way to the Fontan type of connection, thinking that it is going to be better. But things like fenestration in the long term, does that have a positive or negative impact on how the circulation flows? All of those things are things that we're still trying to find out. We also appreciate that exercise in people with Fontan circulations is altered, and there is a spectrum of exercise performance in people with Fontan circulations, but there is generally a degree of restriction in how people perform, and that's kind of intrinsic when you think that you've only got a pump for your body and no pump to your lungs. So when you do something that's going to increase the work on your heart and increase the work on your lungs, that it's not going to perhaps perform as well as it would with someone that had a normal circulation. But the sort of dynamics and what goes on behind that, we still don't know a lot about. The other thing is that what is the body makeup of people with a Fontan circulation? What is their bone density? What is their muscle mass? What is their sort of relative proportions? Does that have an impact on how their circulation works? And how does all of that impact on people's quality of life and how they function in society and what they are and aren't able to do? So this is where this big study comes in. And so I'm just going to take you through the different components apart from the MRI, which Sophia will cover. So echocardiogram, it's a pretty standard tool that we use clinically. We're also using it in this study, partly because it gives us information on heart valve function, which is great. It does give us information of the push and the pull aspects of pump function. And it does give us some information on the flow in the Fontan circulation. I'm an echo person myself, and so I am always a big proponent of echocardiograms. I love living in 50 Shades of Grey, as you can see from what I'm wearing today. But even I have to admit that unfortunately echo does have limitations, even with all the technological advances. So whilst it's less invasive than MRI, we can't always get all of the information that we can get with MRI, which is why they're complementary. There's some things echo can give you that MRI can't, and vice versa. The other thing that we're also doing, because we want to know how the Fontan circulation performs with exercise, is this thing of cardiopulmonary exercise testing. So for any Star Wars fans that are out there, unfortunately it will mean that you're sort of more on the dark side of the Force with the Darth Vader mask, but the cardiopulmonary exercise testing is, has generally been quite a fun thing for people to take part in. It gives us an assessment of exercise performance. It also gives us information, and that's where the mask comes in, on how oxygen is taken in and used by people with a Fontan circulation, because obviously it's going to be managed differently to someone that has a normal circulation. And the other side of the cardiopulmonary exercise test is we're also obviously looking at the electricity of the heart at the same time. So it gives us information on the rhythm of the heart, how people's heart rate speeds up during exercise, what their blood pressure does, all of those. So it's quite a comprehensive thing. Chantel's alluded to the impact of anticoagulation potentially on bone density long term, and so part of the study is also looking into that, as well as that whole thing of, you know, what is the body makeup of people with Fontan circulation, how much muscle mass do they have, all of those kind of components. And so that's why there is this bone densitometry component of it, which looks at bone density and muscle mass. Both of these we know are affected by medications, but they're also affected by exercise participation. And I know for a long time there was this kind of thing that people used to say, if you had a Fontan, then, you know, you shouldn't push yourself too much, and maybe you shouldn't sort of take part in a huge amount of exercise, but we're obviously completely changing that idea. And so with the exercise component plus the bone densitometry, we're sort of looking at the interaction of those different things and body proportions. So, you know, weight relative to height, all of those kind of things. So that's two things that are happening with the bone densitometry. One of them is this DEXA scan, or dual energy X-ray absorptiometry, which is a bit of a mouthful. So basically, as you see in the picture, you basically lie down. It is an X-ray type scan, no needles involved. And basically it does a whole body assessment of the bone density, how much fat you've got and how much muscle mass you have. And then for a more specific measure, we are using peripheral CT. So as you can see there, it's like a mini donut instead of the big donut that people are used to when they put their whole body in. And that's just looking at arms and legs, and that gives a volume cross-sectional assessment of bone density of your arm and your leg bones. There's also other big components. We're looking at brain MRI. I call it brain teaser testing because it's cognitive testing and quality of life. And that's all interacts with the whole Fontan circulation, fenestration, the blood thinners that we use, and how that impacts on how people function. So we're doing brain MRI. Does the brain look any different in people with Fontan circulations? Does it look the same as the rest of us? What strengths and difficulties in brain function do people with a Fontan circulation have? And then the bigger sort of things of how do people with a Fontan circulation feel about their life? How does having a Fontan circulation impact on how you live life? The brain MRI obviously does involve that little headset. I'm trying not to sort of explain it as looking like Hannibal Lecter from Silence of the Lambs, but you can kind of look as a sort of sci-fi kind of thing with a halo, and pretend you have magic powers. And now I'm just going to hand over to Sophia to talk about the MRI component.